Hi, Dr. Crenshaw here, coming back for another module of HSA 6930, Human Resources for Healthcare Organizations. I hope you guys are enjoying the materials. I think this week I think, a really great topic on recruitment and selection. Um, you guys have done a great job in the discussion threads talking about the importance of our human resources in the delivery of healthcare. And so I think this is definitely one of those topics that are incredibly important related to how the delivery of healthcare, and that we have to choose the right talent for our teams. And so, want to chat a little bit about the idea of the firm individual fit framework as it relates specifically then to how we select our teams. So, probably one of the most important things I believe in selection of talent in healthcare. I think it's important in every organization or every industry, but I think maybe specifically in industries like healthcare where the actual product is care for people, is that there has to be a real values and mission alignment, right? That the intrinsic motivation, the thing that drives the individual, is really that, delivery of healthcare. Compassion, excellence for, I like to say in healthcare, like, are we treating every patient the way we would want our loved ones treated? Those that are most precious to us, or are we treating others that way? And so, what are the things that we'd want to assess to make sure that we're getting that value alignment when we think about um, the process of hiring the team? Many of you probably are hiring managers and do make decisions about who you want to have on the team. And so you want to think about, like, what is the candidate's why for working in healthcare? What kind of response do you get when you say, like, why did you choose to be a nurse? Why did you choose to be a licensed clinical therapist? And, really feeling good about the answers. Now, really important in interviewing, before you ask any questions, you want to have thought about, like, what are the right answers? And you want to be sure that people are not kind of bamboozling you with what we like to call glittering generalities, right? You want folks to be really specific in their answers. And as an interviewer, right, like, try not to let them get away with those glittering generalities. Ask them to be specific. You want them to give examples of compassion, teamwork, ethical decision making. Again, being careful that they aren't kind of like making up stories in their answers, right? Like, ask them, tell me about a time when, and ask them to be very specific. Where did this happen? What was going on, right? So that you can tell if this is an experience they really had. And then you want there to be a fit with the organization's values and the patient centered care culture, right? It's okay to meet a nurse, a doctor, a physician extender who is great at what they do, but maybe isn't a cultural fit for your practice, your hospital, your clinic, right? And when that's the case, when they're great, but they're just not a fit, it's okay not to hire them. I assure you that having the position be open for a little bit longer until you find the right talent is going to be better for you, for your teammates, for the patients in the long run. So, look, this all sounds pretty lofty. How do we make it happen, right? We incorporate behavioral interview questions, scenario based assessments that probe for empathy, integrity, and purpose driven behavior. Adaptability within complex systems, right? Healthcare environments are dynamic, constantly changing, requiring adaptability and resilience. How do we find that resilience, right? You want to look for the ability to navigate ambiguity. This is like one of my absolute favorites, right? Really finding out like, how do you do when things are constantly changing, right? You want to make sure that folks are comfortable with that cross-functional collaboration, right? We call it interdisciplinary care teams, right? Like dyad partnerships. Dyad partnerships are one of the most important. Like, how do you find that doctor or that director of nursing who works well with the business leader, the administrator, um, can really work well with payers, understanding like where are our goals in alignment, in making sure that we all care for the patients. Sometimes there can be some rubs, right, in those relationships, and it's really you really got to look for those folks who can maintain um, the right attitude in those complex systems. So, how do we do that? Again, situational questions, right? Maybe some judgment tests. Looking into past experiences. Again, asking people, tell me about a time when, and not being really careful not to allow like those fictional answers, right? Really dig in. I like to ask people, like, be so specific in your answer that you'll actually give me names. Obviously, protect the innocent, HIPAA, all of that, right? I don't care if you make up the name, but who was there? What were they doing? Right? Like, be really like, give me the scenario. Tell me the story. What role did you play in this? You're really trying to get to that motivation based interview question, right? Where you're finding out, is there an internal or an external locus of control? And here at the end of today's video, we're going to talk more about motivation based interviews. One of my all time favorite tools. I learned about it in the early 2000s at a Society for Human Resource Management conference. I'm going to talk to you about a book written by Carol Quinn. I was in Carol's session at that conference many years ago. I have used her book for years. I have used her method for years. Cannot say enough positive about it. Truly believe that it has helped me be a great selector of talent. Okay. So, how about competence and continuous learning, right? You really want that person who's not just incredibly competent today, but is willing to change with the times, continuous learning. Like, how are we incorporating AI? We've talked about that a lot in this course. Like, how is that making its way into healthcare, and how do we deal with that? And are we hiring clinicians and administrators who are open to those changes? Right. So clinical competence is always going to win the day, right? But also, how do we, what are we assessing, right? Evidence of maintaining or expanding licensure, certifications, and making sure that there's just a real interest in quality improvement initiatives. So, how do we make it happen? Ask about how they've handled clinical errors or sought feedback to improve outcomes. If you've not done much reading around the idea of psychological safety, I would definitely encourage you to do that. The author I'm talking about here is Amy Edmondson, and she wrote The Fearless Organization about psychological safety, and it was based on research that she did on medication errors, right? And so, like that idea of like, how do we handle errors? What do we do when we realize that something has gone wrong? What's our approach to that? Asking that in the interview and really getting a sense that the people that you're selecting are going to be a good fit in your organization for how they handle mistakes, how they handle seriously challenging situations. It's really important to know in the interview process, right? You don't want to wait and find that out when you've spent time, energy, money on getting them onboarded, right? Like, nothing worse than in the fourth or fifth month of somebody's employment finding out that you just didn't ask the right questions, or you didn't go deep enough, and this person isn't exactly what you expected. All right, team fit, also really important, right? Like, who do you already have on the team? What are maybe some gaps in, like, hey, are there skill sets that we need to round out? Is there behavior style that we can round out, right? I work in a company right now where I'm finding that we don't have a lot of D's, right? If I use the four styles of behavior, right? Thinking about DISC, right? My drivers, my influentials, my steadies, my conscientious, right? We're an organization that is very heavy, like across. I say very heavy, pretty well distributed actually. Um, I's and C's, I'm sorry, I's and S's, influentials and steadies, right? We're very people oriented, very relationship oriented. And then our third is those conscientious with like that data orientation, that reserved data orientation. But we really don't have a lot of drivers, right? And so as we hire, especially among our middle management, right? Should we really round ourselves out, right? So we want to, assess interpersonal style, conflict resolution skills, a respect for diversity as we're hiring, right? To make sure that we're like rounding out the team. So consider panel interviews, peer interviews, or shadowing experiences that gauge the interpersonal chemistry and the collaboration of people that you're bringing on to the team. All right. So I mentioned Carol Quinn and motivation based interviewing. Actually wanted to just go ahead and like bring her book to your attention. Published in 2002. Don't Hire Anyone Without Me: A Revolutionary Approach to Interviewing and Hiring the Best. You can still get it on Amazon. I know it's an older book, but I really do think that it's timeless in its approach. So, Carol Quinn offers a powerful enhancement to healthcare selection practices. Really, motivation based interviewing really gets to the core of motivation. Are you internally motivated, internal locus of control, or external locus of control? So, do you choose healthcare based on a desire to help others, right? It really, there's that a fulfillment, an internal fulfillment of like, I am motivated by my own internal drives, right? Versus we could still meet folks who say, right, like, I chose healthcare because jobs are plentiful. There's always going to be a healthcare job, and it's always going to pay well. Those are more external motivations, right? It's that like, hey, I have to work, I need a job, I need to pay the bills. And so it may as well be a job that's in demand and a job that pays well. There's no judgment about that, right? Like I want to be careful that we don't say that there's a good and bad. But just simply to say, choose well-rounded team and know what your person's motivation is. If that jobs are plentiful and the pay is good, is the motivator for somebody that you hire, and you have the opportunity to motivate them with bonuses and overtime and those kinds of things, that can be a very beneficial relationship. They come, they do the job, they do it well, and you can reward them well, right? Again, no judgment for that. Just make sure that your organization is able to support what motivates them. Of course, the watch out, right, is to be fully effective in healthcare, we also have to integrate it with cultural fit and clinical competency. So just knowing how somebody's motivated isn't enough in healthcare, right? It may be enough in sales, but in healthcare, you also have to have that clinical competency, right? You want that to be right at the very upfront. There's really no point in considering a candidate who doesn't have the skill set for the job, especially from a clinical perspective. And then culture fit being very important. We already talked a lot about that. And then third up, I think, is this idea of like, okay, what motivates this person? And are we going to be able to keep them motivated here in our organization? So, just generally, right? Quinn's premise is that skills and experience are necessary, but alone insufficient predictors of high performance. And so, the real differentiator in Quinn's study and opinion is motivation, specifically an individual's achievement drive and response to challenges. And so we want in a healthcare setting then to figure out like how do how does this candidate respond to obstacles? So as a hiring manager, right, once you have verified, yes, they have all the credentials we need, they have the clinical skills and experience, we think they're a good culture fit. Now you really got to get in and uncover like how does this person approach obstacles? First, we have to answer like what are the real obstacles in our organization? I like to ask, like going into any hiring situation, like first, like, hey, tell me, what are the barriers to success here? Again, thinking about the company that I work with today, we are we are growing very fast. We are a startup. We are figuring it out as we go. We don't have a lot of competitors in our space that are doing this the way we're doing it. And so there's a lot of trial and error, candidly, right? And so, especially on process and like opening new clinics and like what should caseload look like and how many clients should we have before we start hiring the next set of, right? Like what's that volume? What are the unit economics look like? We're still figuring all that out. And so, working in an environment where there's a lot of ambiguity and a lot of new parts and new process and trial and error figuring it out, that's a potential obstacles to success, right? And so we have to know that when we're hiring, and we have to hire for that tolerance for ambiguity, that tolerance for constant change. Because honestly, people who don't have that tolerance aren't going to be happy. And so we are very specific to make sure that we are screening for, hey, how have you managed these kinds of obstacles in the past? How do you feel about it? And what are the skill sets you've learned in order to really sustain that type of resiliency over time? All right. So motivation is a differentiator. Well, great. We know what behavioral interviewing is. How is it different from motivational interviewing, or are they the same? Right? So, a traditional behavioral interview will ask what a candidate did. Motivation-based interview digs into why they did it, right? And so you want to ask the questions and really give them an opportunity to talk about, like, okay, so that's what you did. What was the barrier that you ran into? How did you get around it, over it, under it, right? How did you get past that difficult situation? And why did you keep trying, right? And really finding out from the person, like, what's most important to them, what motivated them to keep pushing. Why didn't they give up? Why didn't they come across an obstacle or a barrier and just stop and go, hey, somebody help me, right? What was the thing that caused them to like keep forging through? That's really what you want to know. So, look, in a healthcare setting, as an example, two nurses may have identical technical skills, but one may show deep internal motivation to improve patient experience. Which one will you want? The one that has great skills, but, has basically said, honestly, I take a lot of great pride in being a great nurse and taking great care of people. But they don't necessarily show that like extra step of like just really being all in dedicated to the improvement of patient experience. Then, maybe you want that nurse who really is all in dedicated. the same time, as a hiring manager, let's be honest, if in your organization those frontline nurses aren't really given an opportunity to affect change, if you are in an environment where it is most important in your organization that those frontline nurses just follow protocol, then you probably don't want to hire somebody who is very passionate about creating change, right? Because they will be frustrated. They will keep trying to tackle barriers that the organization doesn't want them empowered to tackle. This is why it's important to know what you're hiring for and to include the environment. So, how do we make that happen, right? Incorporating those motivational based questions. Tell me about a time you faced a major setback. What kept you going? And then really, dig in there, really try to figure out like, what is that motivation? All right. So Quinn's model assumes that the individual brings motivation, but the organization must provide the environment. So I just gave an example, right, of like that two nurse situation, or like what if somebody is really passionate? I have a licensed clinical social worker that's really passionate about affecting change, but what if they're working in an environment in an environment where we're saying like, we don't want to change that yet, right? We're not able to change that yet. They may not be satisfied. They may not enjoy that environment, right? We find that right now we are hugely attractive for social workers who are very interested in providing charity care because we are able in our model to serve everyone. And so we are able in our model to accept all forms of payers, and we are able in our model at times to provide charity care. And so I find that we are a very attractive option for licensed clinical social workers who have been in environments where they've had to turn away charity care. And so that might be a good fit for us. Also, we should consider, if somebody really wants to be working for a nonprofit and that's important to them, we are not a nonprofit. And so there are going to be revenue goals, right? There are going to be unit economics that our teams will have to be concerned about because we're not a nonprofit. And so while charity care is important to us, success and meeting our revenue goals is also important to us. And so all of that has to be balanced and managed. All right. So talking a little bit about the limitations, right? So um, I mentioned this earlier. We just want to make sure that we're adapting for healthcare, right? So we'll combine motivation-based interviewing with values-based hiring to ensure alignment with the care ethos, right? We're going to integrate the competency-based and situational assessments for quality clinical assurance. And we're going to make sure we train interviewers to distinguish intrinsic motivation from emotional over-identification or burnout risk. They can look really similar, right? So we have to be really careful that we're not seeing like somebody isn't so tied. So what is this emotional over-identification, right? That somebody isn't so tied to their identity as a clinician that we're mistaken that kind of like my identity is that of being a nurse practitioner, right? We're not mistaking that like what we see, what is intrinsic motivation for this over identification. It's a fine line. May not always be able to tease it out, but I think as you're interviewing and you're talking about like transitions, hey, when you left this role, what caused that transition? If you're hearing repetitive burnout, it could be a sign that this person does struggle with emotional over-identification, right? That they just really put their whole selves in and are at high risk for burnout. And that may be a situation to avoid. I know that potentially sounds harsh because obviously we want people that are very committed. But honestly, we need a balanced workforce. We need people who know how to balance, um, giving of themselves in a healthcare environment, but also knowing that you have to put your own oxygen mask on first. Not to be over cliche, but that's true, right? Like we can only we cannot pour from an empty cup. Another overused analogy or cliche, right? But so put on your own oxygen mask first, and remember to fill your own cup because you can't pour from an empty cup. All right. Well, hopefully you found this information helpful as you think about selection. Um, I really do like the motivation-based interviewing. If you are a hiring manager, hopefully you will check that out. If I can answer any questions for anybody about it, happy to do that. And thanks for listening into today's video. Have a great day.